Sinel Specialist Family Hospital. Understanding the menstrual cycle. Today he's doing daddy duties, taking his daughter to school, but he's delegated a worthy representative also with the Obs and Gynae group or team at Sinel Specialist Family Hospital. Dr. Risch Appiah joins me as we continue our foundation on the menstrual cycle. Join us on WhatsApp 055 11 11 997. We're live on Facebook and YouTube. Ultimate Health is the program and it's a promise. Joy 99.7 FM is a frequency. Indeed, it's a family.
Joy 99.7 FM.
Alrighty. Thanks for tuning in. I'm humbled to be here and with Dr. Risch Appiah with the Sinel Specialist Family Hospital. Doc, you're most welcome.
Thank you.
Right. You have a word to say to your mama?
Just a shout out to my mom, Sarah Edu. She's the best mom in the world.
Yeah?
Yeah, I just want to thank her for all her sacrifices and making sure I had everything I needed.
Right.
To be where I am today.
Right.
Mama,
Great.
I love you.
Right. Great stuff, huh? And you know what? Mothers out there, if there was ever a job vacancy, a job advert for this role that you play in the world, not just in individual lives and families, but if there was a job vacancy and they told you what you know now of motherhood, would you have applied? And now that you know, would you ever want to consider resignation? This is something I want to put out to you. You can share with me on WhatsApp, 055 11 11 997. Ultimate Health on Joy 99.7 FM. This and every Sunday, 2:05, we are live with me, Nortey by Nature. We bring you all the impacts, the issues that impact on your health and your well-being, and we bring in all the requisite qualified professionals and practitioners to share with you. So if you have any questions, concerns, 055 11 11 997. So Dr. Appiah, last week we set out with Dr. McCarthy. We learnt about the menstrual cycle, but a lot of people jumped ahead of the gun, and they brought in all their problems. They wanted to know safe period and so on and so forth. Today we are going to do a menstrual lockdown. A menstrual lockdown. We want to go through the basics of the normal cycle. When you hear menses, what does it mean? What exactly, specifically, is ovulation? What are the hormones that, trigger these changes that go on in a woman's body on a cyclical basis and so on and so forth? Then maybe we can look at some of the deviations and the problems. So if you've just joined us, we're going to do this and lock it down for a bit so that we can all get the fundamentals. Right?
Sure.
Before we talk about what can go wrong with it and the problems you want to shoot. Men wanted to know, when exactly can a woman get pregnant? And so many other things. They were contentious issues. But Doc, you're welcome.
Thank you once again.
So the menstrual cycle, as soon as I bring in cycle, then it's just much more than the bleeding. So let's kick off with explaining, when we say menstrual cycle, what exactly are we talking about?
Okay, so when we talk about the menstrual cycle, we are talking about a series of events.
Okay.
That happens in the woman.
Right.
And it leads to it's basically the event that is preparing a woman for pregnancy.
Okay.
And when there is no pregnancy, you have some bleeding.
Okay.
And it's normal. It's very, very normal.
Okay.
Okay, so it's just some series of events that happens.
All right. So the cycle refers to a series of events, specific things that are programmed to happen in a woman. So every woman should menstruate. Every woman should experience this cycle of events.
Ideally.
Right. Ideally. Okay. So that's one thing out of the way. So several things happen during this cycle. Most references, when I read up, start with the first day of bleeding, right? And then we run through the process. So why is a woman bleeding? And is it just blood?
Yeah, so actually, your first day of the cycle starts with the bleeding. I'm sure when people go to the hospital, or ladies, when they go to the hospital, sometimes the doctor will ask, when was your last menstrual period? And it's actually the first day you started bleeding.
Okay.
Now it's not just blood. It also
Okay.
contains tissues,
Okay.
dead tissues from the endometrial lining. That's the womb lining,
Okay.
and some cells and some mucus discharges as well.
Okay.
So it's not just blood.
Right.
Okay.
Okay. So every month, your body as a woman holds itself in preparation and readiness for pregnancy.
Exactly.
Right? And these steps it takes to prepare itself for pregnancy constitute the cycle, right?
Yes.
Okay. Now, when there is no pregnancy, all the preparation or the lining of the womb has to go.
Exactly.
Right. So that is your first day of bleeding when you are shedding some of these things, which you've just said and shared is not just blood.
Yes, please.
Okay. Right. Typically, how long should the average woman bleed? Emphasis on average.
Averagely, you should bleed for 5 days.
Right. Averagely.
But it's a range because every woman is unique.
Okay.
You know, some people can just have bleeding for just a day or two.
Okay.
And then it's considered normal. Some people too bleed for as long as 7 days.
Right.
And it's considered normal. But
Okay.
averagely 5 days.
Okay.
You should have the blood coming.
All right. So,
Yeah.
folks, if you're listening to me, this is Ultimate Health on Joy 99.7 FM. My name is Nortey by nature. I'm in the studio with Dr. Risch Appiah of the Sinel Specialist Family Hospital. We're going back, continuing our understanding of the menstrual cycle. Remember, cycle. So it's not just bleeding. It's not just safe period.
Yeah.
It's not just ovulation, right? And I've got the right person in the studio, so you've got to listen up before you start firing your questions, all right? I insist. We are on menstrual lockdown, okay? Right? When I want the phone lines and the WhatsApp to bleed, I'll tell you, all right? So let's listen and understand. Okay, now, the bleeding should be averagely 5 days, right?
Yes.
Some people can bleed as little as 3 days.
2-3 days or even one.
Right, even 1 day.
Even one.
Right,
Yeah.
and some more than 7 days.
Some even more than 5-7. Some even bleed 7-8 days, and it's just normal.
Okay, right.
Joy
Now,
99.7
let me come back to the
FM.
cycle before I come back to the actual bleeding, or what some people call the period or the menses, right? The cycle typically also has a duration, right?
Yes.
Okay, how long should the cycle of events be?
Yeah. So once again, every woman is unique. But averagely, you should have a cycle length of 28 days.
All right, averagely.
Averagely.
Okay.
But there's a range of 21 days to 35 days.
All right.
Okay. So anything less than that should warrant some investigation, or
Okay.
anything beyond that should warrant some
Right.
investigation.
Okay.
Sometimes we've had some cases where women bleed for more than 35 days, but ended up less than 42 days, and it was normal. You know, after
Can you
investigating.
just go over that? The bleeding refers to the menses. So you are talking about the cycle now, not
Yes.
the bleed, not the period.
Not the
Right,
period.
because you mentioned bleeding 35 days. I was a bit
Sorry,
worried. Yeah.
I meant to say
Okay.
the cycle
The
length.
cycle length.
So we have women who have had the cycle length go beyond 35 days
Okay.
or less than 42 days.
Okay.
And after investigation, everything was fine. It was
right.
normal.
Okay.
And it happened subsequent months.
Okay.
So it was normal. So
Right.
sometimes we have those rare cases.
Okay. Doc, can you as a woman declare something normal without seeing a doctor? I mean, you know your body. You know how it feels. You know how it behaves. When it comes to your cycle, you know, should you be plotting this yourself? Last week, Michael McCarthy mentioned some of the apps that allow you to track this.
Yeah.
Should you just decide that, oh, my cycle is this long or that long, or do you need the help of a qualified professional to do so?
No, actually, you can do it yourself. The apps are made in such a way that it's simple to understand. It's simple to put in those information. So you actually don't need a doctor or any specialist to help you with the app per
Okay,
se.
right.
You just need to track your menses, and
Okay.
then if there are any changes, you just input it in the app, and then it gives you the predictions.
All right.
Of your cycle.
Okay.
So it's as simple as that.
Okay, as simple as that. But I brought in a professional, so it tells you there are some complexities that you need to understand. This is Ultimate Health on Joy 99.7 FM, your ultimate guide to healthy living. We're talking about and we're seeking to understand the menstrual cycle. If you have any questions, concerns, experiences, challenges, our WhatsApp is 055 11 11 997. We're live on Facebook and YouTube. Every Sunday we do this. It's a promise. It's not just a program. After us, as you know now, every Sunday we have the Joy FM pop quiz, the family pop quiz. I've seen some families revving up in their wings, and they will be doing that alongside Lexus Bill, right? So, hey, you got a lot of reasons to stick and stay on Joy 99.7 FM. We're learning about the menstrual cycle. Hi, I hope you're doing well. Happy Mother's Day to my dear wife, Linda Che, Mrs. Christiana Che of Evangel Christian Church International, and to my mother-in-law, Mrs. Agnes Annabelle of Nima, wishing them the best of the day. This is from Che in Westlands. All right, great. Let's see. Okay, these are wish my wife, Juliet Edem Lavo. Happy Mother's Day from Gilbert Mensah, working at Multimedia. Well done, Gilbert. All right. If you have any questions, shout outs, and specific questions, experiences, with regards to the menstrual cycle, share with us on WhatsApp. Okay. So we have an understanding of the duration. Okay. Anything outside the ranges that Doc has mentioned for the full cycle, 21 to 35 days. Averagely,
Yep.
you can be less than that or more than that, but it would require some investigation and follow-up to understand why. And for your bleeding, it should be averagely 5 days. It could be less, it could be more. Again, any deviations from this average must be investigated before, even raising alarm, okay? A doctor will get to tell you those things. But if you have any questions, concerns, WhatsApp is 055 11 11 997. Okay, so we understand the bleeding is what people typically call the period or the menses.
The menses.
Okay, right. Last week we established that girls are starting this whole process earlier. Typically, it used to be around age 12. I'm told it can be as late in starting as age 16. Where would you put it? Typically, when girls, especially in Ghana, starting to have their cycle?
Well, we are still seeing girls having their menses around 12 to 13 years.
Okay.
But like my boss said the last time, we are having a decline in the age.
Right.
Okay, so we've seen girls having their menses as early as 9 years.
Okay.
And it's quite interesting.
Right.
So we, it's all due to their diet and some other factors.
Right.
Okay, so now they are very healthy, so they are
Right.
having their menses early enough.
Okay, all right. So if you're comparing your daughter to other daughters or people or your time, there've been a lot of significant changes nutritionally, physical status, and many other things that have pushed the age of menarche, that's the first cycle, lower and lower and lower. This means, and we emphasized this last week, that schools should be aware, parents should be aware, and they should help in equipping young girls with the skills to manage this. It can be traumatizing. It is very early or very late, depending on what is happening with your peers. So schools, parents, and even men should have an awareness of this and be able to help support the young girl and equip her with the skills for feminine hygiene and preparation for all of these things. Yeah? Okay.
Yeah.
Right.
Yeah.
Okay. Good stuff. And so we know why it's called the menses is the flow, right, of the lining and other co-meaning, as doctor has said. All right. This whole process, I understand, is triggered by certain hormones.
Yeah.
Right? They give the brain and the body the messages to start preparation for a possible pregnancy. Can we talk briefly about that?
Yeah. So the whole menstrual cycle cannot be possible without the hormones, and the hormones are produced by the brain. There are some structures in the brain. So we have the pituitary gland and the hypothalamus.
Okay.
And then we also have the ovaries as well.
Right.
These structures produce the hormones that regulate the cycle or that help the cycle to function normally.
Okay.
So we have hormones like estrogens and progesterones, or follicle stimulating hormone, or FSH and LH. That's the luteinizing hormone. Yeah, they come into play, and this interplay should be regulated well enough to have a normal menstrual cycle.
Okay.
Yeah.
All right. So there are brain chemicals or body chemicals that regulate these events that constitute the menstrual cycle, right? So they will give the green light or the red light to the body to produce X or Y hormone, and this will trigger the changes. Some of these messages or chemical messages will tell the uterus to start lining itself in preparation for
Exactly.
a pregnancy or a fertilized egg to lodge itself, all right? If that doesn't happen, it will give another counter message which says, hey, get rid of all the stuff, all right?
Exactly.
Stop work, AME, all right? Something like that.
Yeah,
okay?
exactly.
So you need to understand that there are hormones. And again, when you are seeing specialists or doctors, they'll be interested in some tests which will, measure and evaluate or appraise these hormones and the quantities and so on and so forth. All right? We're growing and learning on Joy 99.7 FM. The program is Ultimate Health. We're seeking to understand the menstrual cycle. It's difficult but not impossible. That's why I've got Dr. Risch Appiah from the Sinel Specialist Hospital in the studio. We're live on Facebook and YouTube. Shortly, I will activate the phone lines so that you can have a direct consultation with Dr. Appiah. We are active on WhatsApp, 055 11 11 997. Questions, concerns, experiences. Okay, confessions. Right? Testimonies. You can share them with us on Joy 99.7 FM.
Joy 99.7 FM.
All right, so we're understanding, we're growing. So all of these things facilitate the process and make sure it is within the norm, which also leads me to ask, Doc, so anything wrong with these chemical messages or hormones and so on and so forth can also cause an irregularity in the menstrual cycle?
Very much.
Right.
Very much.
Okie dokie. We're growing, we're learning. Very soon we shall be obstetricians and gynecologists. I shall give out the certificates.
Our mothers are actually the first obstetricians and gynecologists.
Right, because they had to understand these
Yeah.
things and had to manage them. Okay, right. So we've talked about the menses, which we said typically is or averagely is about 5 days.
Yeah.
Okay, right. So you're getting rid of all the preparations because you are not pregnant.
Yeah, exactly.
Okay, because you are not pregnant.
Because you're not pregnant.
Because the egg that was released by the triggering of the follicle stimulating hormone.
Yep.
Right, which tells the ovaries, the egg factories, release one egg. Right.
Exactly.
It is released, and hopefully it will meet a sperm legitimately, legally, huh? And then they come together, and if it is fertilized, then the thickening walls of the uterus
Yeah.
will accept that
Accept it.
fertilized egg. Right.
Yeah.
If that does not happen, then it has to get rid of all the
Exactly.
stuff.
So what really happens is that the hormones prepares the womb
Okay.
to receive the embryo.
Mm-hmm.
If the egg does not get fertilized,
Right.
some of the hormones have to withdraw.
Okay.
Like the progesterone, it withdraws. So when it withdraws, then there's the shedding of the endometrial lining.
Okay.
And then you have your menses coming
Okay.
in.
All right. Okay.
That's what happens.
So if you are not pregnant, if the sperm missed the penalty, did not score, right, then the egg itself would disintegrate and all the comininis and all the things, right, I'm trying to make it as simple and basic and fundamental as possible, will be shed. And then there'll be a new construction over a cycle.
Exactly.
Right, the same way they do 1D, 1F, right? Okay.
Yeah.
So the factory they started building is set aside, right? Deleted and shed. And that is your 5 days, 7 days, 3 days of bleeding. All right.
So it's like a constant loop of building and then breaking down.
Okay.
Building and breaking down.
So
basically.
a woman or a girl's body goes through this phase from when they are they've reached puberty or reproductive age all the way to menopause, when they stop producing eggs or releasing eggs.
Yes.
Right. Okay. Yeah. I hope you understand that. Any questions are welcome on 055 11 11 997. This is me, Nortey by nature. No, I don't do women's plumbing, but I've got a gentleman who's in there. He goes down in there, checks the pipes and all the things that happen down there. Dr. Risch Appiah is from the Sinel Specialist Family Hospital. All right. And happy Mother's Day once again to our special women who have to contend with this cycle, which is preloaded, divinely preloaded software. All right. And if everything is working, you have this working as well. Okay, Doc. So we know there's a period within the cycle. Unfortunately, I'm using the word period. Maybe it's not right. There's a phase.
Accepted.
There's a phase within the cycle where we say the egg is released. And most women know that as ovulation. Can we demarcate and cite and locate? Give us the GPS location within the cycle of ovulation?
Okay. So first of all, this question is a bit
Technical?
or the location is a bit technical.
Technical.
In the sense that it differs from woman to woman.
All right.
Depending on the menstrual cycle.
Right.
Okay. But if you have an average cycle of 28 days,
Right.
your location or the ovulation day
Uh-huh.
should be on day 14.
About halfway.
Yeah, halfway. Day
About
14.
halfway through your cycle.
Yes, halfway.
Right?
To your
You should
cycle.
release an egg.
An egg.
Okay.
So people who have the 21-day cycle,
Mm-hmm.
I don't know if the listeners, people listened last week.
Oh, they did. They don't miss. If they miss, we find them.
Dr. McCarthy actually mentioned that there was those who have the 21-day cycle,
Right.
they might ovulate earlier than usual,
Okay. Earlier than the 14
than the 14th.
days.
Exactly.
Right. And we started counting the days from your first bleed.
First bleed.
Okay.
Exactly.
Folks, I'm doing all this so that you understand the pink sheet, so that there's no overvoting. And so that when we gazette that you are pregnant, we have an understanding, okay? And that's why I've got the specialists, the doctors in the studio, right? So from your first day of bleeding, we are counting 14 days. If you have a typical 28-day cycle. By day 14, you should have released an egg.
An egg.
Okay. All right. And all of this is controlled by the chemicals, the hormones I talked about. Now, you're saying that for those with a shorter cycle,
Yes.
shorter than average cycle, they will release the egg earlier than 14 days.
Earlier than 14 days.
Okay, why is this so?
Actually, you see, people calculate the menstrual cycle this way, that every time on day 14, from the day they bleed, you should release an egg. But it is not actually so.
Okay.
It is rather backwards.
Right.
So, for example, if you have a 21-day cycle,
Right.
14 days backwards, that will
Okay.
be your 7th day of your menstrual cycle.
All right. 14 out of 21 will lead you with your 7th day.
Yeah.
Okay.
Do you understand? So
Right.
if you rather time it, you're on the 14th day of the cycle, of the 21-day cycle, you might actually miss it.
You might miss it. Okay.
You get it. So it differs based on your menstrual cycle.
All right.
From woman to woman.
Okay.
But averagely, if you have the 28-day cycle or the perfect cycle, what they call the perfect cycle, day 14 is fine.
Okay. Note that Doc and I are choosing our words cautiously. Perfect, normal, these are very subjective, all right? It doesn't mean that if you don't have a 28-day cycle, you are abnormal or
Exactly.
imperfect. All right?
Exactly.
I know you guys, you will start calling in and say, my wife is... No, let's get it straight and let's understand why we're doing this lockdown so you all understand before you start asking your questions. If you just joined us, it's 31 minutes past the hour of 2 on Joy 99.7 FM, the 8th of May, Mother's Day, special day, and we're going into this enterprise that we set to understand the menstrual cycle. It's very, very important to have this foundation, right? Men and women alike. And note that menstrual starts with men anyway. Menopause starts with men, okay? So we're in there and we're covered.
Joy 99.7.
Right, great stuff. I've got stuff on my WhatsApp. Let me see if I can read a couple. Remember, WhatsApp is 055 11 11 997. Right, you can't miss it, as the guys would say in the UK. My daughter started her menses 2 months before her 10th birthday, and she bleeds for a day. Is this normal? Is it expected to change as she grows? So 2 months before her 10th birthday, so that's what, like 9 years, 10 months, right?
Something like that.
She started around then, and she only bleeds for a day. And Mom is asking, Mom, do add your name next time. Huh? We like to get friendly and close, right? She's asking if this is okay, and will it change as she grows?
Okay, so this has been happening since the 10th birthday, before her
Right.
10th
Okay.
birthday.
She doesn't say how old she is now.
Yeah.
Right. Okay.
So if this is happening, then it's likely her normal cycle.
Right. Okay.
It's likely her normal cycle.
So she will always bleed for one day?
One day.
It's possible.
It's possible.
It's possible.
It is very possible.
It's also very possible that it could change
It can change.
based on some factors.
Based on some factors. It can change based on her diet. Maybe if she changes her diet, weight loss, weight gain,
All right.
it can change.
Okay, great. So, Mom, it starts, okay. Is this the mom I know? This looks like you, Eunice in Jordan. Is that you? Hey, all right. All right, it looks like a Jordan number. I think I know who this is. Okay, if you have any questions, concerns, 055 11 11 997. Oh, the phone line has started to bleed. Excuse my language. All right. 0300-302-216-541. I wanted to lock things down and cover some territory with Doc, but some people want the votes counted and the ballots, right? I have another one. I have a caller on the line. Okay, let me take the caller on the line. Hello, good afternoon.
Good afternoon.
Right, your name and where you're calling from, please.
My name is Mary and I'm calling from Dansum.
All right, Mary. Share with us.
Please, I want to ask that if you bleed for 2 days, is it normal?
Okay, Mary, did you start the program with us?
Yes, please.
Oh, then you should know it is normal. But I'll let Doc answer that, okay?
Okay.
Are you just asking the question or is that your actual experience?
That's my actual experience.
Okay, let me hand you over to Doc. Doc.
All right. So if you are bleeding just 2 days every month, then it's likely to be very normal.
Okay.
So don't worry about it.
Right.
Likely to be very
Doc,
normal.
is it the case that women tend to compare themselves with other women?
Yes. So we do get these comparisons a lot at the hospital.
Right. My auntie bleeds like this.
Yes.
My cousin.
Actually, they what we are actually experiencing is that the mothers rather tell the ladies that this is not how the ladies in their house, this is not how we are.
Okay.
So it gets them worried and then they come to the hospital.
Yours is peculiar to this family.
Exactly.
And that gets them alarmed.
Yes.
All right.
That's one. And then also they are comparing themselves to other friends.
Okay. All right. Great stuff. So we're trying to situate or locate the ovulation, right? And you mentioned that those with a shorter cycle of events will ovulate earlier.
Yes.
And they need to be mindful of this, especially and particularly because people like to calculate when they are likely to get pregnant if they are seeking to have a child, right?
Exactly. So the other side of the coin is also very true. If you have a longer cycle, you shouldn't expect your ovulation day to be on the day 14 of your cycle.
Okay.
It could be a bit after that.
All right.
So you have to be careful. So that is why you need the app, because sometimes the app is able to track all these things, that this month you had a short cycle or this month you had a longer cycle.
Right.
So it's able to predict that the next month these days will be your fertile period.
Okay.
So the apps are really helping.
All right. Yeah. Okay. So you should know your fertile period. You should know your body. Otherwise, the goalpost will be shifting. And the goalkeeper will have some challenges, all right? But particularly if you are seeking to conceive, you should understand these things and harness them in your bid, and the doctors can help you with that when you go to the family planning clinics and all that. They educate you on these things, right? The unexamined life is not worth living. If you just joined us, it's 36 minutes past the hour of 2 on Joy 99.7 FM. My name is Nortey Dua. Call me Nortey by nature. I'm in the studio with Dr. Risch. Appiah. Am I pronouncing the Risch right?
It is normal.
Right, it is normal.
It is normal. It's a normal cycle.
Normal cycle. I saw the spelling and I said, hey, this one I have to take my time, right? It's not Risch.
No, it's not
Risch. Okay.
Yes.
All right. Great stuff. This one says, hello, Nortey. My girls are teens and they sometimes have painful menstruation. What can we do practically with or without medication to manage them? Right, dysmenorrhea. Teenagers and painful menstruation.
Yeah.
Is there anything the mother should be doing? Well, it says my girls. I'm assuming it's the mother. It could be a father as well. Yeah.
Of course.
Yeah.
Yeah. So this is a classic case of dysmenorrhea.
Okay.
And dysmenorrhea sometimes needs to be investigated because it could be a problem of endometriosis.
Okay.
But most dysmenorrhea, especially if the ladies are or the girls are young, they are teens, they don't have any other cause, just normal menstrual cycle dysmenorrhea, and basically some painkillers will do, or sometimes you just have to use the hot water bottle to just help. It helps.
Okay.
And you can't do much about it because basically the pain is from the uterus contracting
It's
just
internal.
to get rid of the blood,
right,
or the bleeding,
lining.
lining. So it's not anything abnormal. Okay, but you have to deal with it.
Right.
But the good thing is that it is most people after childbirth they get to the pain comes down. Actually,
Okay.
the pain really comes down.
All right.
So-
Great stuff. But before I read this from the day in Maryland, Doc, let me ask you. I mean, can you say emphatically, is your period or are your menses supposed to be painful? Are they normally painful? Is pain the norm?
No, I wouldn't say pain is the norm.
I know you haven't menstruated before, but
Oh,
let's get the women and the
Yeah.
men to. Is it normally, typically, characteristically painful?
it's I wouldn't characterize it as a normal thing all the time, because some women tend to have no pain, little to no pain at all.
All right.
And the subject of pain it's actually very subjective.
Right.
So someone might be feeling some pain and she's fine with it, and if another person would be feeling that same pain,
Okay.
the person will be screaming on top of her
Alright.
voice. So it's a very subjective thing. But
Right.
yes, we do have people who have the pain and people who don't have.
Right.
So we wouldn't say that menstruation should be painful.
Right.
Typically.
Typically.
It should
right.
be.
But if you experience pain, report it.
Yes, if you experience pain, report it.
Okay. Great stuff. Let me take this caller on the line. Hello, good afternoon.
Yes.
Right. Who am I speaking to?
Now,
Zinabu, where are you calling from?
Dansuma,
Dansoman. Okay. Share with us, Zinabu.
I want to ask that if I finish having my menses on the fourth day, is it normal?
So you're saying if you bleed for 4 days and it's done, is it okay?
Yes.
Okay. Zinabu, how old are you?
30.
13. Okay.
Yes.
All right. And you started having your cycle already? Okay. Zinabu.
Hello.
Have you started having your menstrual cycle already, Zinabu?
Yes.
Okay. Right. How old were you when you started?
No.
You were 12. Okay. All right. So Zinabu is asking with some coaching from Mommy on Mother's Day, right? She says 4 days she's done. She started maybe last year, and we've established that this can actually be the norm.
It's actually very normal.
Okay.
So Zinab, you shouldn't be worried about it.
All right.
It's very normal.
Okay, great. That's a 13-year-old listener to Ultimate Health and a listener to Joy FM.
Interesting.
Zinabu is most welcome. With these days, doctors, hospitals, they want educated, health literate patients. They are the best to work with,
Yeah.
right? So it's good to ask these questions. WhatsApp is 055 11 11 997. Do I have another caller? Yep. Nope. All right. Okay. Let me do some of my WhatsApp. There was one from Dede. It's jumped. That means Dede is still typing. She does that to me sometimes. Okay. Right. Okay. Dede says one's cycle changes with age and other variables such as medications, diet. So how can one keep up with their cycle so as not to soil one's clothing? This is from Dede, right? It can embarrass you, huh? So if it changes over time, but Doc is saying by and large it should stay consistent or constant. And she also forgot. She says, and it also will play games with pregnancy timing.
Yeah, sometimes the menses can be. There are people who have irregular menses.
Okay.
And it's it can be normal. What I mean, or irregular menstrual cycle. That's
Okay.
the term.
All right.
So those people, that is their thing.
Right.
Today is 21. Next month it's 24. Next month is 35.
Okay.
Those people, you cannot put a hold on them.
A straight jacket.
A straight jacket on them. Yeah, exactly. So people like that, if they are planning for pregnancy or if they are trying to avoid pregnancy, or they are doing the calendar method trying to avoid it, they have to be very, very careful. Very, 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 very careful.
Okay. I got this one from Razak Mensa. He says, can BTL change your menstrual cycle? I'm racking my brains. What's BTL?
Bilateral tubal ligation.
Oh, right. Okay. That one. All right.
Yeah, BTL shouldn't change your menstrual cycle, because
Okay.
what BTL does, it's basically a tying of the tubes,
Yeah.
and then you are just cutting a part away, so it doesn't affect your womb or your cycle in any way.
Okay. Right. Okay.
Rather, the pregnancy can
Uh-huh.
affect it.
It can affect pregnancy.
Yeah, your pregnancy
pregnancy
can
can-
affect your cycle.
Your cycle.
For example, if you used to bleed 4 or 5 days, after pregnancy, you can even now shift to 3 days or 7 days.
All right. Good afternoon, Joy FM. Please, if one bleeds more than 1 week or 2 in a month, and it can start just after a day or two again. So you bleed more than 2 weeks in the same month, then 2 days later it starts again. I've been injected with the family planning. Okay, so she's using the injectable. This is Hajia from Winneba, right? So she's talking about a longer duration of bleeding. It stops. She bleeds for a week or two, which is already quite long.
Yep.
And then it stops. Then it starts again 2 days later.
Yeah, so
but she's on the injectable.
Yeah, so this patient actually needs investigation.
Okay.
She might need she probably needs to just stop the injectables, because
Right.
some of the injectables actually can cause you to have these irregular bleeding or cycles.
Okay.
So she needs further investigation at the hospital.
All right. So Hajia, please go back to the facility and have this checked, and then they will review your family planning method. I guess that's what Doc
Yeah.
is saying. Good afternoon, Nortey. Please, I would like to know from Doc how much family planning or the impact of family planning on the monthly flow. In other words, does family planning alter the normal flow? This is from Parkumi in North Kanishi.
The question is actually quite incomplete.
Right.
Because family planning is a big umbrella. So which
That's
family
right.
planning
Which method are you talking about?
Yeah.
Okay, right.
Yeah.
But is he perhaps suggesting contraception?
Yeah, I think
Right.
he's talking about the hormonal
Contraception. Right.
Yeah, so it can actually alter your monthly flow.
That's what it's actually supposed to do, isn't it? Oh,
Yes,
in a way.
if you're on it,
Yeah.
it's either stops it. In fact, it's supposed to stop your cycle,
Right.
or as one of the side effects, you can have some little spotting
Right.
or bleeding.
Okay.
But then it's okay, and then it stops.
Right.
And after you discontinue the contraception or the
Right.
oral contraceptives, we have a majority of people or women they go back to their normal cycle, and we have some women who don't even have their menses at all, or
Okay.
they have
It takes some
a
time.
change.
Yeah.
Those things are you need time to actually ascertain
Right. What has happened.
what is happening.
Okay.
Yeah.
All right. Great stuff. My phone line 0302216541 is still active. We're still live on Facebook and YouTube. The program, as always on a Sunday afternoon, is Ultimate Health, your ultimate guide to healthy living with me, Nortey by nature. I'm in the qualified presence of Dr. Risch Appiah of the Sinel Specialist and Family Hospital. We're seeking to understand the menstrual cycle. If you have any questions, concerns, experiences, share with us 055 11 11 997. That is WhatsApp, and 0302216541. You see, I'm flowing. That's a heavy bleed. Right. Good afternoon, Nortey. Please, I want to know from Doc if regular intercourse can reduce menstrual cramps. This is from Kaunda in Fadama.
This is a very serious question.
Powerful question from Kaunda in Fadama. Regular intercourse, can it help ameliorate? I want big brofo. Eden. I want big brofo. Regular intercourse, you are doing the do plenty. Can it help with cramps? I think the person is looking for a license. All right. Let me just quickly take this call.
Sure.
And then come back. Hello.
Good afternoon.
Good afternoon. Hey, Ajingo.
This question, if you ask the question, you can tell me, say, I'm suspect.
Ajingo from Tema. Please, happy Mother's Day to you. Please share with us quickly.
Happy Mother's Day to all multimedia women. Please, if this my question has been answered, forgive me, but I've been following. My question is, what is the problem when a woman is having her menses at the same time pregnant? And can diet also change the menstrual cycle?
You dear, if you don't bring diet into an ultimate health question, then it's not you. What the problem is, the woman is pregnant and having her menses at the same time, right? I know, I'll bring it to Doc. Any bleeding during pregnancy is not okay.
Yeah.
Right? It must be looked at. But I have another caller. Hello, good afternoon.
Hello,
Yes, good afternoon. Who am I talking to?
this is Hayford from Baton.
Hayford from Bato.
Yeah.
Okay, share with us quickly, Hayford.
Yeah, please ask Doc for me. I have a girl who normally complain about having mens before the mens come. What may be the cause of it?
She complains of having it before it comes.
Yeah.
Okay. And you want to know why she does that?
Yeah.
Okay. Is that, when you say you have a girl, is that your girlfriend?
Yes.
Or you are a landguard? All right. Okay. Let's come back to the one about regular intercourse.
Yeah, regular
Does it help with cramps?
So
I've got my fingers crossed as I ask you. Does it?
the thing about regular intercourse reducing cramps is actually the thing is orgasm.
Okay.
Yeah, so you can have regular intercourse, but if the woman is not having orgasms, you are not doing anything.
So if you don't arrive,
yeah, if you don't arrive,
okay, some will say come, but if you don't arrive, if you don't
Yeah.
orgasm, then it
Yeah.
has no impact.
yeah, I mean,
But you're
orgasm-
suggesting that if you orgasm, then it has an
yeah,
impact.
orgasm has an effect of reducing cramps.
Hmm.
Yes.
Okay.
Yes, so it is not just about having regular intercourse.
So you
It's
could be
about-
doing unskilled labor.
yes,
and you are
just
not
cost
Oh.
90.
All right. Okay. So there's a relationship there.
Yes, there's a
But it's
relationship.
related to orgasm, climaxing.
Yes.
All right. Okay. We'll get to do those sexual cycles, right? And then can a woman be pregnant and still have menses?
So it again, I mean, this thing is very serious. If you are pregnant and you are bleeding, don't think it's menses.
All
you
right.
need to go to the hospital because it could be anything dangerous.
All right.
Okay, so
Okay. You're not
please,
supposed to bleed
you are
if you're
not supposed
pregnant.
to bleed
Okay.
if you
And
are
you're not
pregnant.
supposed to have your menses if you're pregnant.
Exactly.
So any blood during pregnancy, please go to
Yeah,
hospital.
Go to the hospital because
Okay.
it could be life threatening.
It could be life threatening. Okay. Hello. Good afternoon.
Good afternoon.
Right. Who am I speaking to? Hello.
Hello.
Yes. Who am I speaking to, please?
Please, you're speaking to Israel.
Israel. All right.
Yes.
Israel, where are you calling from?
Please, I'm calling from Agege last stop.
Agege last stop. Okay. Give me your last
Yes.
question. Yeah, Israel. Mommy, please let Israel talk quickly.
Okay. When my sister's menses stops, it doesn't reach up to 28 days, and she gets her period. Is it normal?
Okay. So, Mommy, can you ask the question for Israel? If Judea is there, ask for Israel.
Okay, he's saying if the sister's menses stop, it doesn't reach up to 28 days, then she gets her period.
Is it normal?
So she
Is it
finishes
normal?
bleeding. How old is the sister in question?
13,
She's 13. So she bleeds for how long?
5 days.
5 days. And you're saying
please.
after the 5 days, you're expecting the cycle to run, but not long after that, she starts to bleed again.
Yes, please.
How soon after the end of the bleeding does she bleed again?
About 19 days.
Okay. All right. Doc, 13-year-old has about a 5 days menses, right? And the mom has been listening and looking at the average, right? But she's talking about a shorter cycle.
Yeah.
Right.
Yeah. So this is an extra short cycle. And
So that's
it-
19 plus 5, or?
Yeah.
Yeah, she bleeds for 5 days, so we're
Yeah,
counting from the
yeah.
first day of bleeding.
Okay, I assume
and
it was
then
on the 19th day or
19
something like
days after,
that. So that
she bleeds again. So that is 24 days.
24 days. That should be normal.
That shouldn't be a
Yeah,
problem.
that shouldn't be a problem.
Okay.
But I assume that maybe on the 19th day, let's see, because sometimes you cannot tell what they mean.
Okay.
Yeah.
All right.
So if it's extra short, like it's an extra short, let's say
Right.
19 days, it just warrants a lot of
Right.
investigation.
But it's much more than 19 because she bleeds for 5
Yes,
days. And
yes.
the 5 days
I
is
mean,
part of the cycle.
if
okay.
it's- yeah, so
Mom,
it's 24
Yeah,
days.
Mom, I think from what Doc is saying, you need help with the counting. No need to alarm yourself yet. But if you go to a family planning clinic, you can get assistance with the proper counting so that you don't frighten a 13-year-old that there's a problem. All right. It sounds okay, but it must be looked at if there's some concern. Good afternoon, Nortey. What accounts for the change of cycle days for the menses? Example, for the first 3 months, it's 32 days. You see, the cycle is the whole thing. The menses is the bleeding, right? I'm seeing you use the term differently, right? So duration, the cycle is 32 days, then the next 4 months is 28 days. Doc mentioned this. We saw a range of 21 to 35. So you are still within a range, but she's asking what accounts for the change.
Yeah, I mean, like I mentioned earlier on, so diet could be a problem. Well, not a problem, but it could be a factor. You can have change of weight loss, weight gain. You sometimes even infections, pelvic infections can affect your cycle.
Okay.
So these are just some little factors that can affect it.
Okay, I'm going to quickly run through my cycle on WhatsApp. Huh? Good afternoon. Is it normal to menstruate twice in a month? This is from Ken in Tema. Doc.
Menstruating twice in a month is not normal.
It's not normal. All right. This one wanted to ask, the one that asked Pakumi, he wanted to ask if an implant could affect the monthly flow.
Yeah, so
that's what we talked about.
Yeah, so it's a hormonal type. So
all right, okay. Please read my question. Hey, my girlfriend bleeds 3 days. Is it normal? Kojo in SM City. Kojo if our home bank. Okay, all right. But he wants to know 3 days.
It's very normal.
It's very normal. All right,
your girlfriend is safe.
Right. Kojo has ulterior motives, but I know he wants to know what the pink sheet should read. Right. This one says, "Hello, Lexus. Welcome to our homes. Happy birthday wishes to your Julie. Hey, no, hang on. Hey, Nortey Dua, please. Happy Mother's Day to you too. Renee at Dodua. Usubi." Right, we're running out of time. If you have a question or a concern or an experience with regard to menstruation. Okay, I'm scrolling. Hi, knee Nortey. I always drop the knee. I'm not a knee. Hey, okay.
They are giving you a cheap.
Kindly mention where Sinel Hospital can be located. Not only the name. Thank you, Sinel. It's Community 6 Tema, right? The ECG junction, right?
Yes.
If you know Community 6, the UK folks will say you can't miss it, all right? Right? But Google too. If it was fast food, you have Googled and gone there a long time. All right. Good afternoon, or regular intercourse. We've answered that. It's orgasm, regular orgasm, right? The doctor said it wasn't me. Can one be ovulating during menstruation and get pregnant? Dede in Maryland. I almost said Dede in menstruation, right? Can you be pregnant and be ovulating and menstruating at the same time?
Can you be pregnant and ovulating?
No, sorry. Can you be ovulating during menstruation and then, as a result, get pregnant?
Ovulating during menstruation and as a result get pregnant. Well, we need to ascertain that this menstruation is really menstruation,
because menstruation means there was no pregnancy and you are shedding what is in there.
So if it's really menstruation, you shouldn't ovulate and you shouldn't get pregnant.
All right, so that's the technicality.
Yes.
Right.
So you need to really find out if it's really menstruation.
Right. Were you bleeding and were you shedding off?
Perhaps.
Right.
Okay. It could be another problem.
It could be another problem.
Yeah.
All right. Okay. Good afternoon, Nortey. I used to bleed for 4 to 5 days when I started menstruation, but now it lasts for 3 days. I turned 30 this year. I want to know from Doc if this is normal. This is another Dede.
Yeah, Dede is very normal.
Okay.
It's very normal.
All right. Okay. When doctors say it's normal, they are putting themselves out of business, but it's a good thing. All right. Good and educative show. Please, Nortey, I would like to know the difference between gynecology and a gynecologist and a midwife, from Tony in Nsawam. Doc.
Okay.
Right.
A gynecologist is a doctor.
Has done medicine.
Has done medicine,
Right.
studied, specialized. And a midwife is a nurse who has studied midwifery.
Right. Okay. Agbena. Back. Good afternoon, Nortey. I am Edem from Tema. I have 4 kids and I had a bilateral tubal ligation done after my 4th child. And my menstrual cycle has never been regular. A whole 4 months, I won't flow. So I think BTL brings some irregularities. I used to flow every month, but it's not the same. Right.
No, you see, the BTL is a procedure where you tie the fallopian tubes. So it shouldn't cause that. Mm-hmm. I think what we need to do is that we need to investigate why you are having the irregularities, but not tying it to exactly, right. Not tie it to the BTL.
Right. They are related in time, but it's not a causal relationship.
Exactly.
That's what Doc is saying.
It has no association.
All right. Thank you, Doc, for a wonderful work on my triplets. God bless your work, from Razak Mensa. Hey, Doc. Charlie, your hands are fertile. Triplets. Okay. Well, that's congratulations or thanks, appreciation. Good afternoon, Nortey. I have a short cycle. So this is me to menstruate sometimes twice a month. I have a 26-day cycle sometimes, and it reduces sometimes to 24.
Okay.
All right. So she says she can clock twice in a month.
So the cycle was 26, now drops to 24.
Yeah.
And so it makes it look like it's twice a month.
Yeah.
So technically, it shouldn't be a problem. But if you are having it twice in a month,
right.
What I'll do is I'll suggest you give it some time and see.
Right.
If you are still having
Monitor?
monitor and see. If
Right.
you are still having that problem, come to the hospital and let's
Alright.
check you out.
Come to the hospital, come to a hospital and have yourself checked out. We're almost out of time, huh? We finished bleeding. All right, please, is it normal to bleed twice in a month per the doctor's discussion? Because if someone's menstrual cycle is 21 days, yeah.
Yeah, in a way, that's why I said that you have to just monitor.
Okay.
Because if you have that short cycle, 21 days, you can bleed like in 2 months,
Alright.
in a month, two
Okay.
times.
They have conspired, all of them, different people. My menses can begin in a month and then I begin again in the same month. So we have several of those. We'll probably do something about that downstream.
Yeah,
all right?
I think so.
Okay. Wow, this has been awesome, informative, transformative, educative. Wow, something, Tiff, right? Thanks, Doctor, for wonderful work on my triplets. Okay, Razak is thanking you again, all right? I guess he'll thank you 3 times since they're triplets, right? But many thanks, immense thanks to you and appreciation to you, Dr. Risch Appiah of the Sinel Specialist Family Hospital in Tema. We are continuing this focus, so maybe we'll bring you alongside your boss, like you like to say.
Yeah.
But thank you so much for educating and enhancing the richness of our program. Thank you so much.
Thank you too for having me.
Right, many thanks to my producer extraordinaire, Abeku Sankofi. And hey, I'm revving up to move out because there's a certain Lexus bill coming up with the family pop quiz. New, exhilarating, exciting. Families come in and they face off. Stick and stay, don't go away. Joy 99.7 FM is the frequency. It's also a promise. My name is Nortey by nature. I'm out like that.